Greetings, everyone. My name is Dr. Davina Liggins, and I'm with Healing Made Whole. And I've come here today to give you a very strong warning to everybody with prediabetes. So, whether or not you have symptoms or not, prediabetes is very dangerous, and here's why. Higher than normal blood glucose levels causes damage to arteries and the small blood vessels. This puts you at risk for heart attack and stroke. And in addition, most individuals, I should say all individuals with prediabetes, have chronically high levels of insulin. This is called hyperinsulinemia. This is oftentimes not even talked about. And what chronic high levels of insulin does, it affects the body. For example, it can lead to hardening of the arteries. That also increases the risk of heart attack and stroke, even angina. Also, high levels of insulin, this hyperinsulinemia, also puts people at risk of cancers. So this is very serious. And I don't want anyone to think just because you don't have a type 2 diabetes diagnosis that prediabetes is acceptable. It is not. There are many symptoms that can be associated with prediabetes in addition to a heart attack, stroke, and etc. And let me just read those to you. Of course, high levels of insulin, high blood glucose levels, higher than A1C levels. Those are standard. However, individuals with prediabetes can have blurred vision. You can even start to get numbness in your hands and your feet. There's weight gain. There's even potential for kidney damage. There increased urination. There are many different symptoms that can come about even with prediabetes. So please do not think that you are flying under the radar. And what I would like to say is that most individuals who have prediabetes, their goal is to prevent the development of full-blown type 2 diabetes and to prevent them from getting on medication. And I would like to say, if you have that goal, that is good. However, you run the risk of staying pre-diabetic. So in addition to not getting type 2 diabetes and not being on medication, have the goal of getting your A1C levels and your fasting blood glucose levels in normal range. Okay, it's not acceptable to stay pre-diabetic if you want to maintain metabolic health in your body. Okay, now the issue with prediabetes is that most people don't even know that they have prediabetes. About 80% are unaware. So I invite everyone to get your fasting blood glucose levels checked, to get your hemoglobin A1C levels checked. If you're starting to move outside of normal range, you have some serious work to do. Get on it as fast as you can. Now, there are two other tests that I invite everyone to take, and that is fasting insulin as well as HOMA-IR. That's HOMA-IR. Now, fasting insulin will help you to know if you have hyperinsulinemia. HOMA-IR will help you to understand if you have insulin resistance. Now, fasting insulin and HOMA-IR are not normally conducted, so you will have to request for these tests. If your doctor is not assessing your fasting blood glucose and your hemoglobin A1C levels on a regular basis, you want to be sure that they are doing that. Make these requests. Be as proactive as you can. Now, when you get these test results back, and if your doctor says, oh, you're slightly out of normal range with your hemoglobin A1C or your fasting blood glucose levels a little bit high, but we're not going to worry about it, we'll just check it in a year. Well, I invite you to not go along with that plan. Be, again, proactive and say, you know what? I'm going to make some serious dietary changes in my lifestyle, and we're going to check these levels in 4 to 6 months, because I can't wait a year, and I need to make sure that the changes that I'm making are putting me in the right direction. That's called being proactive. Stay ahead of it while you are reversing it and making sure what you're doing is actually working. So hopefully this is helpful to someone out there. Please, if you're looking for help on how to rearrange your lifestyle, dietary changes, and other changes in your lifestyle to help get this insulin pathway back in its normal balance, please reach out to me. I'm here to help you, and I will see you all the next time. Take good care.